Welcome to the Neurokrish Immersion. In this episode, we're discussing the future of integrative medicine in India, and we will have with us in this episode Professor B.N. Gangadhar, and I'll introduce you to him in due course. For much of the last century, modern medicine focused on one great mission: saving lives. And in many ways, it succeeded brilliantly. Antibiotics, vaccines, and we saw what they could do for us during the COVID pandemic, emergency medicine, surgery, imaging, intensive care, all these have transformed human survival. But increasingly, the illnesses shaping our world today are different. Not acute infections, not isolated emergencies, but chronic disorders that unfold slowly across years and decades. Dementia, Parkinson's disease, autism are examples of some chronic disorders. Others are stroke recovery, chronic pain, depression, metabolic disease, burnout, long COVID. And all these illnesses force medicine to confront a more difficult challenge. Not merely how do we rescue life, but how do we restore function, adaptation, resilience, and meaning. Because chronic disease is rarely just a lesion. It's often a disturbance of the whole system. And that is where the conversation around integrative medicine becomes interesting once again. Not as nostalgia, not as ideology, but as part of a much larger transition towards systems medicine. One of the fascinating things about modern healthcare is that the better we become at saving lives, the more we encounter conditions requiring long-term adaptation. A patient survives stroke, but now requires years of rehabilitation. A child with autism lives longer and healthier, but needs developmental ecosystems that can work with him or her. A person with Parkinson's disease may live for decades, requiring mobility support, emotional regulation, sleep care, behavioral adaptation, and caregiver systems, and all this amplify as the person continues to live with the disease. And slowly, therefore, medicine is beginning to realize something quite profound. The organism is not modular. The brain cannot be neatly separated from sleep, emotion, inflammation, movement, behavior, metabolism, social life, or meaning. And this is why fields like psychoneuroimmunology, systems biology, lifestyle medicine, autonomic neuroscience, and rehabilitation science are all becoming increasingly important. The future of healthcare may depend less on isolated interventions and more on restoring regulation across the whole system. In an earlier Neurokrish episode, we talked about the wandering nerve, and we explored the vagus nerve as a bridge between the brain and the body. And perhaps this is where the story becomes especially interesting. Modern neuroscience increasingly recognizes that chronic stress, autonomic overload, poor sleep, persistent inflammation, and hypervigilance all influence healing and recovery. A dysregulated organism does not heal efficiently. A frightened brain does not learn efficiently. A sleep-deprived nervous system does not reorganize efficiently. And suddenly, many older practices that we have heard about or come across begin to look different to us. Breathing practices like meditation, yoga, chanting, music, rhythm, body-based awareness. All these we have heard about for years and years, and they no longer are mystical replacements for medicine. They have potentially become state-regulating interventions for us, and that changes the conversation entirely. Now, this is where Ayurveda re-enters the conversation. It's often misunderstood in simplistic ways. But perhaps a deeper contribution by Ayurveda lies not merely in remedies but in perspective, unique perspective that it offers. This is because Ayurveda asks questions that modern systems medicine is beginning to revisit. What is the constitution of the individual? We talk of Prakriti. What creates imbalance? How do rhythm, behavior, sleep, and environment influence health? Why do people respond differently to illness? How do we preserve resilience before disease emerges? It occupies a different language, a different framework, but starts to ask increasingly familiar questions. This does not mean that Ayurveda and neuroscience are identical. They are not. But there may be areas of convergence. And perhaps that is why integrative medicine is re-emerging globally. Not because modern medicine has failed, but because chronic disease requires broader systems thinking. India now stands at a very interesting moment in this conversation. The government's expansion of Ayush, the rise of integrative medicine centers, and recent discussions around dual degree training programs all suggest that the country is attempting something historically ambitious. Not merely preserving traditional systems, but trying to integrate them into modern healthcare. A recent position paper discussing the proposed MBBS-BAMS, BAMS is Bachelor of Ayurveda Medical Sciences, dual degree program at JIPMER asks a very important question. What kind of doctor does the future require? A narrowly specialized doctor alone, or someone capable of understanding biology, behavior, rehabilitation, prevention, systems regulation, and cultural frameworks of healing? But this also raises serious concerns. Critics warn about mixopathy, dilution of scientific rigor, poor evidence, exaggerated claims, and unsafe integration. And these concerns too are legitimate because not all integration is good integration. The answer to poor integration, however, is not blind enthusiasm. It is disciplined integration. And that may become one of the defining healthcare challenges of the coming decades. To explore these questions further, I recently spoke with someone who has been at the center of this evolving conversation for many years. Professor B.N. Gangadhar is one of India's most respected psychiatrists, former Director of NIMHANS, former President of the National Medical Council, and one of the country's leading voices in integrative medicine and mental health. He is also a co-author on this important paper, position paper, discussing the MBBS-BAMS dual degree proposal. I began by asking him a simple question. Why do you think integrative medicine is re-emerging globally at this moment in history?
Have now got access to a lot of traditional methods, healing that is happening world over. Thanks to the media accessibility of material. Earlier, it used to be limited to some sections of families, some sections of ethnic groups where they were practicing some traditional healing. All are coming to light. And now it is fairly democratized. That knowledge is democratized. This is one part of it. Secondly, when people see all these things, they know that it is working. At least they get to know encouraging information from those who are using it. And third point is, it's traditionally it is known old is gold, and people, of course, continue to have faith in what has gotten established, what is being used, and so I think it is very natural that for all of us, world over, actually, people are looking at, and of course, that the World Health Organization has also now taken a lot of interest in promoting traditional methods of treatment. So put together, I think world has woken up. It's not just because traditionalists are advocating it, but I think world also has spontaneously realized.
Do you believe that modern medicine's greatest challenge today is not acute disease but chronic dysregulation and long duration illness? And how does this change the way we think about rehabilitation and public health?
For whatever be the reason. We recently saw the COVID, was all acute thing, and it was a serious concern. And many places were quite unprepared, and it goes on. And the other thing that is emerging today is the antimicrobial resistance. We believe that we have mastered the microbes, but the microbes not allowing us to master them is a challenge that we need to face. So it is not that acute conditions have gone away, or yes, you are right. The other things are cropping up more, which is more important. And then the chronicity remains, disability remains, progression continues, and so on and so forth. We see, being a psychiatrist, I know schizophrenia comes to the clinic and you treat the acute condition. His hallucinations come down, delusions come down, and 1 year, 2 years, 3 years later, we see slowly the negative symptoms surfacing, and 10 years down the line, a good number of people have deteriorated. I'm not painting a discouraging picture about treatment of schizophrenia, but we know that this happens in good number of cases. Although in a majority, managing the acute condition stops the whole process. That's a different issue. But the fact remains, whether it is psychiatric conditions, neurological conditions, metabolic conditions, cardiorespiratory conditions, there is some element of progression that continues, or at least treatment has to continue for a long period. And this has been a growing epidemic. Also, of course, thanks to acute conditions improving the longevity, the longer some of us live, it's more likely that we will be left with some disabilities at later ages of time. So the proportion of people who will require chronic care, whether they are ill or at least to prevent them from illness, this is a growing issue. Consequences of such long-standing concerns that are happening in these people is also another concern which I think we need to address. Put together, there is a need to look at chronic conditions as well, just as much as we have to keep our vigilance on acute conditions.
One concern many scientists raise is that Ayurveda and neuroscience speak fundamentally different languages. Do you see meaningful convergence emerging between them?
Yeah, it's really difficult for me to understand, to get the point as to what you mean by difference in the neuroscience perspective vis-a-vis the Ayurveda perspective. Let's put it this way. From my understanding, the modern science, which of course neuroscience included, looks at the material, keeps going into a reductionistic way to identify the last molecule, which is problematic in this given individual. And so it goes on and on and on, trying to bring it down to the bullseye and then try to hit, which of course yielded success in many ways. Let's appreciate that role in terms of medical practice, whether it is neuroscience or medicine in general. Now, Ayurveda has a slightly different approach, or I don't know about other traditional systems world over. At least here, it is believed that we are going not to that molecule, but to the individual. The individual makes sure that the molecule works well. So we look at the more expansive way of a person being responsible for his own health, and that he ensures, he or she ensures by way of a whole range of activities that the person is doing, and that this atom change is incidental in the process. So you make sure that the person is empowered to manage his own multiple molecules, not just one molecule, and that make sure that the harmony is established. We say that we look at taking the action on the hands of the scientists or the so-called doctors. We locate what is the problem and we correct the problem. We think that the individual can be empowered to correct himself or herself and make things straightened up for him or her, to make sure that the illness doesn't crop or illness doesn't come in. Here, we, of course, the immunization, leave apart all those things, but I'm just trying to make a point that Ayurvedic tradition comes from a more spiritualistic background to the materialistic background. We focus on material molecules in the modern science, which we have been practicing today. I'm not saying that this is good or that is good, but this, I think, is my understanding, the difference. And there is no contradiction to either of them. But I think they can go together very well and be together, remain married, and make sure that a more holistic outcome happens in the process of healing to the individual.
In neuroscience today, there is enormous interest in vagal regulation, interoception, and mind body physiology. Do you think traditional systems intuitively understood some of these principles long before modern neuroscience?
Here, I have a few points, I think, which I need to talk about on this issue. I think you brought it out very well. The traditional systems have seen that there is immense potential in the individual. This has not been tapped. Immense potential in the individual, in the sense, not necessarily the molecular mechanisms of defense, molecular mechanisms of neuroplasticity, etc. Of course, the modern science people have talked about it, but activating this by himself or herself, by his own lifestyle, is something that has been realized by the traditional systems, and they know which individual has which potential and which lifestyle would suit a given individual the best. This matching of individual to the required lifestyle to ensure that his internal systems are harmonized is something that has been fairly well perfected. But is it possible to now test it and bring an evidence for that? I don't think many of the traditional people have interest in looking at the way in which the modern people want the so-called evidence to be demonstrated. So that leave that issue. But the fact is, people had perhaps known how to fine-tune themselves and how to tell a person to fine-tune himself and make sure that he or she goes on. And in fact, there's an inbuilt homeostasis the nature has given to us, that we have to have that apparatus for ourselves to detect it and correct it. This is something that I think the traditional systems have talked about, which is something that we need to look at how they were doing it and what they were doing it, and whether is it possible to be examined with the modern tools that we have. Of course, the vagus nerve is one afferent vagus nerve coming from the gut, from the lungs, from the upper part of our head and neck, all these places, and it goes and ends up in some limbic and different areas and fine tunes the way in which the mind has to then go back and send signals downwards. This has been talked about. respiratory systems, the gut microbial changes that could perhaps happen because of different diet regimens, and then the pranayama procedures, the chanting, whether it is Om, Brahmari, and you can go on and on and on. So the vagal afferent stimulation being autogenous has been known. And of course, vagal stimulation exogenous, we know that it works in epilepsy and in depression. People have been using it. So I think there is a lot of commonness between the two of them. Only that, like you rightly said initially, that whether two of them were speaking in different languages, so they thought they two are different people, but they're not different people. They're the same people. Only thing is that they spoke in a different dialect or different language. It's, people have to now realize that we can trust each other. It is not that it is you and me, it is us. We are together in terms of the healing business that we are into.
Critics often use terms like mixopathy or even quackery. How do we distinguish poor integration from meaningful integration?
See, I have been trained in modern medicine, so is your training, and so were our teachers in modern medicine, and we know that just one medicine is not an answer to many conditions. Very often, we use just not that one medicine. In addition to antibiotic, I also give an antipyretic, and I may also give an analgesic. I may also give some protein supplements. So I do mix. I do mix with a good intent, and I think I have a reason to mix these things. And so this mixopathy is something that, rather than seeing it as some sort of a negative connotation, but I think it should be seen with a way in which a doctor uses something that is useful to a given individual by adding drug A with the drug B with the drug C, etc. And this is known. And of course, today a lot of lot of strategies of treatment, or whether it is ATT or whatever it is, mix. Of course, there is a logic in mixing, because we are mixing it and we know what is the logic. Now the question here is, we bring in another system of medicine, of which I don't know. Because I don't know, I think that this mixing has no sense. But it is likely, world over, it is known that people want a pluralistic approach. And they would anyway be taking another system of treatment. It's not unknown. And more important is that they somehow don't tell it to their treating physician, not because they think it is irrelevant. I think they even have some degree of hesitation to narrate or disclose this, because that person might think that this is wrong. Whether you go to a traditional healer and then say, I'm taking paracetamol or whatever it is, he may abuse me, saying that nonsense, you leave it, you take my medicine. Or the vice versa. You go to a person who is giving you ciprofloxacin and tell him, I'm taking kashaya, and he will say, what nonsense, nothing doing. So this has happened in the past, and somehow this is a feeling that has been pervading in general population. They don't tell each other. The more and more they don't tell each other, mistrust between the two continues. And the patient also think that these two are not trusting each other. So I better follow on my own common sense or my wisdom, and I think in my goodness, I take this, and I seem to be. This is true that in many cultures, many ethnic populations, in many countries, in advanced countries as well, a substantial proportion are taking mixopathy, which is derived by themselves. But I believe if two physicians of two different methodologies can join hands together and see what you were given treatment for his schizophrenia, his depression, his hallucinations have come down, delusions have come down, but he continues to have some negative symptoms. And he believes that for these negative symptoms, a given lehya, or a given kashaya, or anashya, or why even a given yoga practices are giving him some help, and the family wants to practice it. Why don't we see why they cannot work together? So this is important that we see where we can be complementary. The mixopathy from a same system is, of course, is a thing that we have seen happening and we have used it, and we seem to be working on that with good intention and faith, and it has helped patients. So mixing other systems is going to prove useful to the individual. And if you think that we don't know how it works, let's work together and see whether we can understand each other and see whether it works. And I think working together has benefits. We can look at what is most optimal rather than indiscriminately making. I give some medicines, the other person gives some medicine. If both of us join hands and see, okay, this medicine is definitely going to be helpful. In fact, it can reduce my medicine, or it can reduce your medicine, it can reduce your toxicity, my drug. Overall, the person has to get better. If the objective is to ensure that the person has to get better, it is not. There's no need to be unduly exclusive about other conditions. Today, we need to have this degree of inclusivity in our approaches to the individual, with the motive that the person should get better. Also, respect his attitude that he generally goes for one or other complementary medicine in addition to whatever that is being given. And it's also true. It's also true that more and more people are today demanding an alternative system straight away. I have to just narrate one episode without mentioning the name of the individual, a highly placed bureaucrat to be treated for substance use disorder, said that he would take medicines as long as it is not the, in quote, English medicines. So he was, yeah, that's a different issue that he received something, yoga or Ayurveda. I don't know what it, but the point is that he has made this statement. So my guess is this could well be allowed to happen. Let people express it. I think we should know that we have the intent to get the best to the patient. The patient also should have the freedom to demand what nature of treatment that he wants it. So his personal freedom is also something that we must respect and let that be operated, rather than saying that this is it. You have come to this hospital, I'm going to give you only this medicine. So mixopathy, yes, is a concern because we don't know each other. And this concern has to be resolved by mutual discussions and mutual research.
Your recent paper discusses the proposed MBBS-BAMS dual degree program. What excites you most about this possibility?
Okay, on a sober note, I would say that this may not be the best. It would still say that yes, 2 degrees. You ought to be having 1 degree of medical practice, be able to be trained to do both. Two different systems of medicines are regulated by two different commissions. I am forced to adopt this dual degree program. Had this not been there, let's say there was one overarching common health commission, which would allow you to take multiple credits, and each credit lets you practice XYZ processes. It would have been easier. I wouldn't be calling it as a dual degree. Dual degree would envisage, as it is, 5.5 years of MBBS, maybe 1.5, 2 years more to be added, or we have no idea how it's going to unfold if it does unfold. So this is a what should I say, one of the compromised option in the presence of multiple regulatory bodies that are governing health services. Ideally, it should have been an integrated health system which we teach them. And of course, each person can acquire some degree of additional credits to practice X, Y, Z procedures and so on and so forth. This is possible. Today, of course, we have seen the national education policy and which allows this sort of coexistence and learning multidisciplinary education. And these cannot be implemented in health system because now health doesn't come under NEP and it is governed by multiple national commission for Indian systems of medicine. And within the Ayush system, there is another separate national commission for homeopathy also. It goes on. So this is, I foresee, could well be a barrier for integration. But within the current legal system, one of the means was this dual degree program, which is what I think the benefit of this is. It's true that many medical people have been trained in one system, and a lot of people may not want to opt to learn another system in addition. Theoretically possible. But I'm not ruling out the possibility some of us could have the interest to learn both. But at this point of time, there is no opportunity at all. The freedom of wanting to acquire more skills is not possible. This or that. I think many of us may want to do this and that. So it's not just master of one. I may want to become master of two, master of three, master of four. If I have the talent, ability, and I am willing to face the music. But right now, that option is not there. This is a impingement of my fundamental right to acquire knowledge and use it if I am skilled enough to test my skills. So this provision itself, people have not given. So the best approach is this, what we call as the dual degree program. This is a compromised option within the system of regulatory mechanisms that we are expected to follow.
What kind of doctor do you think the future requires?
I don't know whether one size will fit all. Society has a freedom to seek what they want to. Only question is whoever is the help provider, we need to license that person and say that these are the boundaries within which you are operating. And some could have the same shop can sell both masala dosa and idli, and somebody may be trained only to sell masala dosa. I'm just giving a very, very simplistic example. So it's possible that I'm trained in both and I want to use both. And how do I facilitate this? A person may want multiple approaches, individual. Is it possible to give it under one umbrella? Is it possible? There could be some people who can get this training and achieve this possibility. So it is difficult to say that one method is the method and there's no other method. This degree of exclusive fundamentalism, I think we probably have to outgrow and more inclusive approaches, respecting the individual's freedom has to happen. Individual should have a choice. And most people, of course, today may want only one choice. You do only a robotic surgery on me. I don't want anything else. So this is theoretically possible. So I'm just trying to say that individual's freedom, his affordability, and his faith, and multiple things that may come into picture. Keeping that in mind, whoever we are training, whoever we are licensing, whoever we are saying that he is the medical practitioner, should have the best skills that he is using. Skilling should be the best that should happen. And not merely a degree that is conferred on him, but that skill has been the best. So as you know, the National Medical Commission more recently has emphasized on this competence-based medical education. It's of course a new, although not world over, it may not be new, but here we have ensured that it becomes integrated into educational system. I'm hoping over course of time, competence building becomes the focus, not merely theory acquisition. So shift to competence building, which people will also appreciate. how to make it as uh, competent doctor as possible to be available to the individual. Of course, individual should also have the freedom to choose uh, competence A versus competence B, or person having both competences. This is something that I believe could happen at some point of time. It's already happening elsewhere, world over, but here, for various reasons, we know medical services are expensive, billing can be difficult, and most insurance people will not be able to support multiple systems of treatment for the same condition. So these are all teething trouble, and I think we will probably, over the course of time, when people start demanding, people this we will be able to overcome this.
NIMHANS has explored integrative models in mental health and neuroscience. What have you personally learned from that journey?
Being a person from modern medicine MBBS background, uh, my not only mine, a couple of us who worked, and my own teacher, Dr. Janakiramayya, kept saying that uh, you may have interest in yoga. This is the place where began my. Make sure that you are convinced of its validity before prescribing. Not necessarily uh, accept what others are saying. Of course, they are going to be saying that it works. You test yourself whether it works or not. And this is how it started. He let me uh, embrace one of the traditional systems on a condition that you should be satisfied. That's how it began. And when we began to see the results, and what is most important is the yoga people with whom we researched, they were also open for this sort of scrutiny or audit that we were doing on their treatment, which is the thing that made yoga to come into, if I can call it, mainstream. As you know, at least two or three treatment guidelines outside the country have included yoga. Forget our own country. So this has been possible because of this degree of scrutiny, this degree of open-minded research that was possible, and that it went on. And for a long time, even before we began the yoga research, Ayurveda existed in NIMHANS, but again, as another appendage which was working perhaps in silos. It was governed by another regulatory body. It was, again, separate council was giving funding for that. It went on. And we thought the experience of yoga has taught us that it can be integrated. We can conduct the research with the help with the yoga people can join hands with us, and we could put that integration possible. Yoga and mental health integration was possible. So when this issue of whether Ayurveda, which is again another Indian systems of medicine, and Ayurveda and yoga have a lot of commonalities, again, empowering the individual using natural processes for getting the person's health back. So we thought whether the three, yoga, modern medicine, and Ayurveda, can work together and see what is the way in which we can get the best cocktail for a given individual. A given person may benefit only combination of these two or some support from modern medicine. So this we thought should happen with an open-minded approach to clinical care. So we set up the integrative medicine department. The thing was the Central Council for Ayurveda said you can now adopt all our machinery back into your own institute. Institute will support because it should not be too many controls on the professionals which are practicing. So the entire thing has been integrated with the mainstream of the NIMHANS administration. So the NIMHANS administration has the Ayurveda faculty, the yoga faculty, and the psychiatry faculty. They sit together. While I agree, this three different professionals seeing a patient is not something new to psychiatry. Psychiatry patients were seen by a psychiatrist, a social worker, a psychologist, and sometimes even a psychiatric nurse in the ward. So there were four professionals who were approaching a psychiatric patient. Now, I believe whether that's thing, people sharing thoughts, psychiatry, modern medicine, Ayurveda, and yoga, jointly taking a decision about what is best for the individual. This X, Y, Z, or X alone, or Y alone, or X and Y, or Y and Z, or anything else that we need to do. So this is not just be adopted as a clinical practice. At the same time, we are examining each of these options as well in a more scrutinized, research-based way. Many research grants have already been raised, and very recently, one of the highly prestigious journals published a work on practice of yoga during the withdrawal state of opiate addiction, and which showed that there was some benefits. So this goes on. And there are, of course, a good number of research papers, as many as about 200 research papers have been published. I'm not saying this is it, but I think this is the way forward of keeping an open mind, working together, and trying to find solutions. We started in mental health and neurosciences. Other aims have now begun in other branches of medicine as well. And the government has actually set up Ayush departments, it's not departments, Ayush divisions, Ayush buildings, Ayush centers in all the aims, including the Delhi aims and many other aims. So, which is something very extraordinary. I think we should capitalize on this opportunity that is coming up and make sure integration is going to happen at a fast rate as a evidence-based approach to the patient care.
Is India uniquely positioned to build a globally relevant integrative healthcare model?
So, sir, I think you raised a very important question. No time was better than this time to unfold the integrative medicine process. I'll give you 3 or 4 examples. The national health policy earlier and today's national health policy as well, talks about respecting pluralistic approaches by the patients in terms of treatment and having to build an integrative model at some point of time to be able to national health policy. The national education policy, although health doesn't come under education, national education policy also talks about how the Indian knowledge systems have to be harnessed in every walk of education and profession, which has talked about it. And in fact, the national education policy encourages every educational institution to have a division or a section or a place where Indian knowledge systems can be examined, brought back into mainstream science, technology, health, profession, or whatever it is. This is the second thing. And third thing is the National Medical Commission Act. In fact, the National Medical Commission Act very clearly says pluralistic approaches have to be respected. And to facilitate this to happen, the National Medical Commission should hold periodic meetings with the other 2 health commissions which are looking into traditional systems, National Commission for Indian Systems of Medicine and National Commission for Homeopathic Healthcare. So these 2 have to be meeting as often as possible, twice a year at least, and emphasizing the issue that there are multiple administrative, legal, statutory mechanisms that have been brought together to ensure that this issue of integration is smoothened, facilitated, and we take it. Now, the ball is in the court of our professionals. Are we willing to break the silos? Are we willing to see each other with some trust? Are we willing to see that each of us are working for the interest of the patient? And can we all work together, join hands? If this can happen, and I think India is set. I have to give 1 or 2 anecdotes, although time I don't know how much is there. Some of a lot of psychiatrists from India have gone abroad. And of course, since NIMHANS also gets some of the very bright psychiatrists and they have gone abroad. And I happened to visit one of the countries where the very senior psychiatrists of that country's origin complimented me that the doctors who come from your place are extra been doing. But to this education, that we are not seeing. So I believe we have to read between lines, and I think he wants us to bring in some Indian systems of medicine along with our Western education in our people. So this is my take-home message from this very brief conversation. So I'm sure others also could have observed this, but may not have wanting to comment on this. But the fact is, expectation from our medical doctors and our specialists from countries abroad is that we may bring in some richer complement along with that modern medicine, which they're already perfected at their end. Is there anything else that we can complement? So I think we doctors should do the best what they are doing, along with taking the best of the East along with the best of the West to wherever we are going.
Finally, Professor, beyond science and policy, what does healing mean to you now after decades in psychiatry and integrative medicine?
Yeah, being ill is one part of it, and being not ill is another part of it. And being healthy is one part of it, and being well is another part of it. And making sure that this wellness is nurtured is a responsibility totally that rests with me. When I'm saying me as an public, as an individual, while health is my right, I demand from the state. At the same time, a healthy person is the responsibility is also on me to remain healthy, to make sure my society is healthy. Take for example, you want to enter an army or a police, and if you're not healthy, out. I put it in one way that a society has a right to have people who are healthy, which means to remain healthy is my sacred responsibility to the society. I see it this way. So, which means I have to empower myself. I have to make sure that I remain healthy for the sake of the society. I am here for the society and not for myself. So, for the sake of the society, I have to remain well. And if I have to remain well, I have to make sure that I follow all healthy practices, whether it is lifestyle, keeping away from drugs, exercise, and other things. So this will ensure that it's not just not being ill, but I am being well. I'm the most productive person. And promote wellness, you're going to have mitigation of illness, which is known, which are it's common sense to believe. So then no wonder when Government of India launched these 1.5 lakh centers of wellness centers, they didn't say they're all primary healthcare clinics, not healthcare clinics, but they said it is wellness centers. So promoting wellness has been a thought that has now world over sprung. And I'm sure we should own that responsibility, wanting to remain healthy. And every person should think that remaining healthy is his sacred duty and responsibility. And of course, this is one part of it. The second issue is when it comes to healing and other things, it's true that just as much as we say agent, host, and environment, all they are responsible. And we talking of agent as medical people only, we can talk of the agents, cutting that agent away. But the person, host, strengthening is his responsibility, should be supported by many other stakeholders. The environment has to be taken care of. So I think this traditional treatment and traditional teaching, whether it is in modern medicine or in the Ayush systems of medicine, the agency, host, the question of where the emphasis has to be more. The Ayush systems pay more emphasis on host and environment, whereas maybe the modern systems may be paying more emphasis on the agent. And now, of course, they're also beginning to realize that the host is to be strengthened and the environment, of course, has to be strengthened. So I think all of us, as regards healing is concerned, are looking at the same way. But I think if we break the silos, start seeing eye to eye with each other, have the same interest, and be open to learn from each other, health systems in our country in particular, because culturally we have respected all the traditional systems. And we know that the modern systems of medicine can be an extraordinary complement to the traditional systems. And people are willing to practice the traditional systems as a sacred ritual. That's why it is called an Ayurveda. And I think we have to somehow harness that sentiment of the individual to be using those procedures is your sacred responsibility to remain well. Of course, some support will be given when you really fall sick, an accident, and there's a pneumonia, there are some medicine that big. But you please follow this to remain healthy. And just as much as you came healthy to this world, go back healthy to the other world. This spiritual message can make the healthcare business, healthcare strategy very strong in our country, and we are in that position to make this happen.
One thing that becomes very clear from this discussion is that the future of healthcare may increasingly revolve around chronic adaptation rather than acute rescue alone, and that naturally pushes medicine towards systems thinking. What I found especially interesting was the emphasis on the future physician, not necessarily a doctor abandoning scientific rigor, but perhaps a doctor capable of thinking across systems. Because patients themselves already experience illness as interconnected. The fragmentation often exists more within healthcare structures than within human experience. I think this is an important nuance that Ayurveda, neuroscience, and their possible convergence offers. The goal is not to force equivalence between ancient concepts and modern neuroscience. That often leads to oversimplification, but there may be shared terrains: regulation, adaptation, rhythm, behavior, resilience, and systems balance. And neuroscience itself is increasingly moving in that direction. There is, of course, the concern about bad interpretation and mixopathy. This may actually be one of the most important parts of the discussion, because integration without evidence, regulation, governance, training, and accountability can become dangerous. Therefore, the future of integrative medicine depends not just on ideology, it depends on rigor. And there is an India opportunity here to contribute to the future of healthcare. Perhaps the most fascinating thing about this entire conversation is that it's ultimately not about Ayurveda versus allopathy, not tradition versus science. It is about the future architecture of healthcare itself. Modern medicine transformed survival, but the next great challenge may be chronic disease, aging, neurorehabilitation, mental health, resilience, and long-term adaptation. And these challenges, all of them, require us to think in systems. And perhaps that is why neuroscience, rehabilitation science, behavioral medicine, and traditional systems are slowly beginning to converge around similar questions, not because they are identical, but because human beings themselves are integrated systems. The future of healthcare may not therefore belong exclusively to drugs, devices, or ancient traditions alone. It may belong to systems capable of restoring regulation, resilience, function, adaptation, and meaning. And India, with all its complexity and contradictions, may become one of the most important laboratories in that journey. I come to the end of this episode of the Neurokrish Immersion. We thank you for joining us. If you like what we do here, subscribe and share. We are on Apple, YouTube, and Spotify.